Hello, my name is Roger Worthington. I've been representing men and women with asbestos cancer like mesothelioma for the last 25 years. During my career, I've seen many strong women and men who, in my mind, are heroes. They fought hard, they served their country, they were pillars in their community, they were great parents, they were loved by many. I want to talk about a special client of mine who I think has really personified what it means to give back. I've had the privilege of representing the family of John Johnson. John Johnson was a veteran who was diagnosed with mesothelioma a few years ago, and he died in 2012. This is kind of a tragic story, but it has something of a happy ending, so bear with me. A brief medical history. John Johnson, living in Nevada, was having trouble breathing. He went to his VA in Henderson, Nevada, the local regional VA. They examined him and took films, asked him questions, but never really took a biopsy and didn't order the PET scans and CT scans they needed to fully understand why his pleural cavity was filling with fluid. It took them about a year and a half to finally do the tests and finally look at the fluid, look at the tissue, and determine that John Johnson had malignant mesothelioma. It took them 1 year and a half. By the time John Johnson learned of his diagnosis, he was well beyond stage 3. In a word, he was nearly terminal. His family moved out to Southern California and they went to another regional VA in Long Beach. They saw a doctor there. The doctor said, I can look at the possibility of removing his tumor surgically. The doctor, who didn't have much experience with mesothelioma, operated on John Johnson. The doctor opened him up, saw the tremendous bulk and size of this horrible tumor, decided it was too tough to tackle, beyond his realm of expertise, and he simply sewed John Johnson up. That was a grim day in the Johnson family. The doctor had to explain to Sue Johnson and Michael and the family that nothing can be done to help your father, your husband. But the Johnson family refused to quit, and this is a signature trademark of the Johnson family. They refused to quit. Just like John Johnson, a proud Marine, was taught never to quit. They found out about another surgeon within the VA network up the road, up the 405 in Los Angeles at the West Los Angeles VA. His name was Dr. Robert Cameron. Dr. Robert Cameron has a sterling history of treating mesothelioma patients with a treatment modality that he pioneered called the pleurectomy decortication. It's a procedure known as the lung sparing surgery that allows the patient to survive with his lung lobes intact, in contrast to the orthodox treatment or conventional treatment, which is simply a pneumonectomy, which is a lung amputation. And Dr. Cameron reasoned that, heck, the lungs are working fine. The mesothelioma tumor is simply surrounding the lung in the pleural cavity. Why amputate a perfectly functional lung if the tumor is not inside the lung? So he perfected this technique. It's a very tedious technique. It takes a lot of attention, takes a lot of time. I personally have witnessed Dr. Cameron perform the pleurectomy decortication on 4 occasions on 4 of my clients. It's about a 10-hour procedure, sometimes even longer. So Dr. Cameron was the man for the job. Truly dedicated, truly passionate, very reasonable. He examined John Johnson and decided, because of the size of the tumor, at least for palliative care, it was prudent to remove the bulky tumor from Mr. Johnson's chest, and John Johnson agreed. John Johnson underwent the pleurectomy decortication at the VA in West Los Angeles, and Dr. Cameron removed about 10 pounds of bulky tumor. Following that arduous surgery, John Johnson then underwent about 25 radiation treatments. The idea for radiation was to try to destroy all remaining malignant cells that were still swirling in the chest cavity. And Dr. Cameron was very, very straight up with the Johnson family that because of the earlier aborted surgery down in Long Beach, the tumor cells tracked the incision marks and it spread beyond the pleural cavity. And this is one of the things that makes this tumor so bad is during the procedure, during the operation, tumor cells tend to migrate, be underneath the diaphragm and enter the abdominal cavity. And every surgeon knows that with mesothelioma, because it's so big and diffuse and such a big operation, it's impossible to get a clean margin. No surgeon, no matter how skilled they are, can remove all malignant mesothelioma cells from the chest. The best thing they can do is remove all visible tumor, which is what Dr. Cameron did. So during radiation, it was clear that the point of radiation was to try to locate, attack, and destroy all those invisible microscopic tumor cells that were floating around the chest. John Johnson went through the procedure, very, very tough, lots of burns, lots of throat problems, very ill, but he drove himself to the radiation every day, he and his wife Sue, and they went through it, and he continued onward. The tumor, unfortunately with this tumor, it's so bad, it's not a matter of whether the mesothelioma tumor will recur, it's just a matter of when. Sure enough, despite all of the efforts by Dr. Cameron and all the radiation treatments and the strong will and the loving care from the Johnson family, the tumor did recur, and it recurred in his abdominal area. During that whole process, John Johnson sought justice from the companies who poisoned him. He was poisoned by asbestos, and he underwent a very, very long deposition. And during that deposition, Dr. Cameron went above and beyond the call of duty and provided the court, not on one occasion, but twice, with an affidavit stating that depositions like the one Mr. Johnson were undergoing causes stress. Stress reduces resistance, and for a patient who's already suppressed, whose immune system is already suppressed, this could accelerate the patient's demise. Dr. Cameron has always been concerned about the fair and humane treatment of elders, especially cancer patients. And in his view, a view which I share, by allowing the defense lawyers over 20 hours of depositions was tantamount to allowing torture. Unfortunately, in the Johnson case, the judge allowed another 5 hours on top of the 20, making the total deposition time 25 hours, and it was grueling. It was horrible. I won't even go into the graphic details, but fast forward over a 25-day period, the final day, John Johnson sat in his recliner, his favorite chair, and although he could barely speak, although he was in terrible pain, although he had a bowling ball-sized tumor jutting out from his stomach, he testified. He testified because he's a strong Marine, because he doesn't leave the job unfinished. He was doing that for his family. He could have quit. Nobody would have faulted him. The man was hurting bad. He was suffering. But he never quit. He knew that if he quit, all those 20-plus hours of deposition would be susceptible to being stricken by the court system. He had to finish the entire 25. Otherwise, his entire transcript was going to be flushed down the judicial toilet. He refused to quit. The defense lawyers, they knew he was suffering. In my mind, they accelerated his suffering. Dr. Cameron, on 2 occasions, notified them that what they were doing was accelerating his demise. They were torturing him. And they did, and they succeeded. After the last piece of testimony he gave, the defense lawyers left his house. He got up, went to the bathroom. Within 30 minutes, passed out. The medics came. They took him to the emergency care, took him to the hospital. He was in a coma. We never got to say goodbye to John Johnson. He died. The medical records identified deposition stress as one of the accelerating factors in the cause of his death, along with the huge and grueling and malicious malignant mesothelioma tumors. Now that's a horror story, and I almost hate to bring it up, but I'm bringing it up for this reason. That family had every reason to say, I've had enough of this. This is done. The VA failed them. They didn't diagnose him for a year and a half. The judicial system failed him. They allowed torture. He died. Most families would have said, I've had it. I'm done. Not the Johnson family. What did they do? First of all, they lobbied the assembly here in California to change the rule so that lawyers could no longer torture an extremis patient to death with their questioning. Instead of allowing 20 hours, the rule was cut back to 7 hours. And that was a credit to the Johnson family never giving up, fighting for change, wanting justice, wanting to prevent what happened to their husband, to their father, from happening to other plaintiffs with mesothelioma. They didn't want to see that happen again. They didn't want to see it repeated. The rule got changed. They were not done. They were very, very upset that the VA failed to diagnose John in a timely manner. They were convinced that had John Johnson been diagnosed early on using all the procedures, all the diagnostic tools that were available, that John Johnson could be alive today. He could have had his operation when he was stage 1, not stage 4. They could have used various therapies to suppress recurrence, and he might be with us today. Now that is a tough pill to swallow. But the Johnson family said, I don't want to see this happen to other veterans and their families. Instead of simply complaining or just giving up, they went to the VA in Los Angeles and they set up meetings with the chief of staff. They set up meetings with the surgeons. Their mission was to finally create a comprehensive mesothelioma program for veterans. They were aghast and appalled that after all the years of litigation, all the years of knowledge of this disease, the federal government, even though it was duty-bound to help veterans, never had a program. They had a program for Agent Orange, nuclear radiation, post-traumatic stress disorder, but nothing for veterans with asbestos cancer. That was wrong, and they were not going to stand for it. They wrote letters to the officers and doctors within the VA. They wrote letters to politicians, all the senators in California and congresspeople. They wrote letters to former Secretary Shinseki, Eric Shinseki at the Department of VA, Robert Petzel, all the brass, the top echelons of the organization over there. They even wrote letters to the current VA Secretary, Robert McDonald. They wrote letters to him before he became the Secretary, before he replaced Shinseki. All those letters, and other patients, other clients wrote letters as well, urging the VA to create this program. You're lucky you have a doctor like Dr. Cameron available who's willing to build this program and staff it and equip it and make it work. You're lucky. Let's use these folks. Let's get them off the bench and in the game where they belong. None of those folks within the VA even responded to the Johnson family. Not even with a form letter, not even a courtesy letter. Meanwhile, even Admiral Zumwalt's family, Colonel Jim Zumwalt, he sent letters to the VA brass asking them to create this program, to fund a program, treat meso patients, treat veterans. Nothing. Nothing. Well, something did happen. To his credit, Dean Norman, Dr. Cameron, they went ahead and established a program. They went through internal protocols. They did establish a comprehensive meso center. It wasn't called the Admiral Zumwalt Center, but they proposed to do that. So here we are. About a year and a half ago, the VA in LA did create a center. It's a beautiful thing. Great doctors, great facility. They're using modern technologies, telehealth, telemedicine, to allow patients, no matter where they live, all across this great country, to communicate with the VA over the diagnosis, the treatment options, follow-up, and everything else related to medical care. The program exists to help patients get that care, to participate in this program. And it's all thanks to the Johnson family. The Johnson family not only lobbied, not only did they write the letters, they go to the meetings. MJ has agreed to volunteer as at the VA in West Los Angeles to help patients who are going through this horrible experience. He's agreed to volunteer, and he's not alone. There are lots of people I know, clients and their family members, who would love to volunteer their time to help veterans. They never quit, just like John Johnson never quit. They're still going strong. They have a lot to be proud of. The program does exist, thanks to their efforts, but it hasn't been publicized. The VA hasn't educated patients or doctors about the program. The VA has not adequately funded it, and that disturbs me. My dad was a Marine. He was a veteran. He went through this. He didn't have mesothelioma. He had asbestosis, and he had lung cancer of the pleural lining. I know what it's like to get that horrible news that a loved one has cancer. I know what it's like to try to scramble to find doctors with experience, doctors who are compassionate, nursing staffs who care, treatments that actually make sense. I know what it's like. The Johnson family has been extraordinary. They're trying to help. And for that, I commend them. I commend all patients and all family members throughout this country who don't give up, who've seen the worst of our country, seen the worst in our corporate America, and see the worst even in our legal system, but they don't give up, they keep fighting. And that's what makes me proud, and that's what keeps me going. The Johnson family, you're doing the right thing. We've come a long way. We've got a ways to go, but like my hero, like your father, like your husband taught, John Johnson, never, ever, ever give up. Thank you.